to HEALTHlines on CSNN, your Cardinal Santos News Network. We will have conversations with experts from Cardinal Santos Medical Center about matters that impact our health and well-being. Each episode will feature a specialist from Cardinal Santos and talk about new information and breakthroughs in health and science. Because at HEALTHlines, we break tomorrow's health headlines today. Liver disease is usually associated with harmful lifestyle factors like alcohol consumption and unhealthy eating habits. Sadly, we usually ignore or shrug off the damage that we do to our liver until it's too late. The good news is, if we are guided accordingly by the experts, liver disease can potentially be reversible or even curable in some instances. On this episode of HEALTHlines, we have a gastroenterologist from Cardinal Santos Medical Center to provide us with a deep dive into everything we need to know about liver disease. She is also a member of the steering committee of the Asian Pacific Association for the Study of the Liver. Welcome to HEALTHlines, Dr. Diana Payawal. What a pleasure, Dr. Diana, for you to be here with us today.
Thank you, Marilyn, for this kind invitation. And of course, it's always a pleasure to give a talk on the diseases that we are actually specializing on.
Okay, and you are a gastroenterologist.
Correct.
Right? That's
Yes.
how I introduced you.
Yes.
So it's a specialty which is not very much known to many people, right? Tell us what you do as a gastroenterologist.
Well, gastroenterology is the one that is responsible for digestion.
Okay.
So anything from the mouth to the esophagus, to the stomach, to the biliary tract, the liver, the colon, the pancreas, so anything that has to do with digestion. That's why it is a digestive disease. So, true enough, we always take it for granted. Akala natin okay lang siya,
Right,
no?
oo.
So, but a lot of diseases stem from areas that are particularly seen in digestive diseases. Ngayon, like, I'll give you an example. There are the top 5 cancers in the Philippines. So, lung ho ang una, breast, then liver, colon, and then pancreas. So the three of the top 5 are actually
Wow.
GI.
Oh my.
So kaya nga ho dapat we have to learn how to eat well
Right.
and learn how to take care of disease itself.
So this means, Doctora, with all that this time is never going to be enough for us. So maybe let's do this. We gotta have you more than this time. Even now, I'm already saying you're welcome to come back anytime, as
Thank
many
you.
times as
Thank
we
you,
need to
Marilyn.
talk to
Yes.
people out there. So let's zero in then a word that is very interesting: liver.
Opo.
One of the areas of gastroenterology is diseases of the liver,
yes.
right?
So now, because it is a long organ system, we specialize in different areas. There are people who specializes in biliary tract, yung jaundice, yung naninilaw, no? There are people who specialize in the colon, no? Ako po, aside from the general gastroenterology, I took up additional studies for the liver.
What are these studies exactly?
This is, I do interventional sonology. That's ultrasound of the liver. And I do intervention. Ibig sabihin po, nagbabiopsy po kami. We do microwave ablation therapy. That is actually the first one done in the Philippines is in Cardinal Santos.
Oh, okay.
We started with percutaneous ethanol injection, where we inject directly on the liver cancer. And this is actually to kill the tumor itself. And then we progress to radiofrequency, and then we progress to microwave. All of that is available in the center.
Okay, now, you've talked about all this progression in the treatment of liver disease. Before you get there, obviously, you go through stages. You go through even a time when you don't even know that you have the disease. There's something wrong with your liver.
That's very true. The liver is a huge organ in the body, yet it does not complain. It's not like lungs, you cough.
Right.
Ang heart, I think I've seen your CNN on Dr. Art Miranda.
Right,
and he
right.
was he must be talking of chest pain.
Right, right.
Ang liver po, pagka nanilaw na kayo,
Scary.
o pagka nagkaroon na kayo ng tubig sa tiyan,
Oo.
that's the end stage. And we don't like that. That's why I feel that here in Cardinal Santos, we do preventive hepatology. And that is why we see cases early, as I mentioned. We do not like, that is now the trend. The universal health care, of which the government is putting a lot of factors in, is actually geared towards prevention. So, yan po ang gusto nating i-emphasize dito sa ating mga talakayan na ganito, is you learn to take care of your liver early on. Do not drink alcohol. I think marami hong matatamaan dito. Ang dami.
Oo, I mean, that smile says it all.
Kasi po dati, we used to say a glass of wine keeps your heart well. No?
Yeah.
But that has been already out, no?
How big is the glass, though?
Hindi na po. Ang stand ho namin is no drinking.
Absolutely none?
Because it has been linked to a lot of cancers.
No kidding.
From the GI tract, from the liver, of course, from the colon, even the pancreas. Alam niyo naman po, ang ating lapay, no? That's the pancreas, is the one that is being hit by alcohol. And even in other cancers, stroke, and even in crime. If you notice, this is our study already. We did a study, and we noticed that there is an increased consumption of alcohol during holidays. So that is particularly in Christmas. And alam niyo naman po, sa Christmas, marami hong car accidents. In fact, in the New Year, right after New Year, you will see a lot of crimes on the newspaper, and all of them are linked to too much drinking.
Right.
And lately, we have already stated that binge drinking, when you drink 2 bottles of beer in 2 hours. So yung liit na yon, that is linked now to liver diseases.
People out there should pay attention to this. Very interesting. The other thing that I want to ask, we're going to take a little break right now, but when we return from the other side of the break, maybe let's talk about, but how do you know? I mean, what are the signs? What are the risk factors that we should know about? Because like you said, the liver never complains.
Correct.
So there are many times when I hear about somebody had 4th stage and it was discovered at 4th stage, which was too
that's
late.
precisely
Right.
That's precisely the point.
Right. So we'll do that, Doctora. Hold on. Hold your horses. Okay. I want to get right to what are the risk factors after we just take away for a very short break. Back with you on HEALTHlines on CSNN. I am Marilan Lagniton. And with me is Dr. Diana Payawal. She is a gastroenterologist from Cardinal Santos Medical Center. Dr. Payawal, before the break, we were talking about risk factors. And there's something that you mentioned about drinking, and which was a bombshell, because you said absolutely zero. I mean, we talked about just one glass, and you're saying absolutely zero.
Yan po ang stand.
Look at all the sad people out there. No, but this is great. This is good. Yeah.
We just want health in perspective.
Okay, so what are the other risk factors?
Okay, the number one actually is hepatitis B, viral hepatitis B and C. And the WHO has already mandated na we have to eradicate hepatitis B and C by 2030.
In the world?
Global.
Global.
Po.
Okay.
So,
where are we now? Just curious.
now we have 1:10 for hepatitis B. That's 1 out of 10 Filipinos are infected with hepatitis B. And there is a 1 to 2% of hepatitis C prevalence.
Is that aligned with the world data as well?
No. We definitely are in the high endemic area.
Really?
Opo.
Okay.
Sad enough, there is a vaccination program for viral hepatitis B. And ano na po, ang mandate na po ng gobyerno is vaccination at birth. So this is actually PhilHealth. Yun po sa mga nakikinig sa ating televiewers, kung kayo po ay nanganak, libre po ang bakuna sa PhilHealth. So don't forget, you have to get your kids, your newborns, vaccinated. Tatlo po yan, ano? So tayo po, yung mga catch-up vaccination, then we need to spend. But I think we're working out things so that PhilHealth can also help us, no? Ngayon, because of COVID, there was a drop. I mean, it's not only COVID, it's Dengvaxia. The Dengvaxia has shown that it has dropped the vaccination rates. And then, of course, the COVID, it dropped because the gear of the government is towards COVID vaccination. So, natabunan po yung viral hepatitis. So now, we're picking it up from there. I hope we will recover because I gave a talk in the Global Liver Institute about this. We published our article in Lancet regarding how the low and middle income countries are having problems with going to the 2030 eradication mandate of the WHO.
Okay. So drinking,
viral hepatitis, alcohol is a growing concern because the youngest, the date of the Philippines is those in the less than 15 years old are already drinking alcohol. Some of them are drinking in front of their parents, sa harap po ng magulang, at ang magulang walang ginagawa. Ito po ay nakikerry hanggang pagtanda. Kaya tumadami po ang sakit sa atay sa atin.
And there's not much information about really care of the liver. Unfortunately.
Yes, that's what we're doing right now, and that is what Cardinal Santos is embarking. I know we will activate the liver center here, geared towards prevention. And the third cause is, I think everybody is looking, is a metabolic associated fatty liver disease, of which we have published an article. So, kung kayo po ay apat to diabetes, 10% over excess but obese, lean diabetes but metabolic syndrome, and you have fatty liver on ultrasound, you have to see a doctor.
Do you ever get a sense that you might have fatty liver? Or, I mean, when you're a little obese or when you're a little heavy, is that something that's a sign that you might have fatty liver?
Yes, obesity is now a growing concern because that's the cause of cirrhosis in some patients. And that is why, dati po, nung estudyante ako, about when I came back in 2000, when I finished my fellowship, wala pa akong fatty liver noon. So it was a growing concern at that time. No? So we thought fatty liver is just, when you get obese,
you gain weight.
You gain weight, you have fat in your liver. Ngayon, nakita ho namin na ito na pala ho yung nagkakaroon ng cirrhosis, yung tumitigas yung atay. Kasi ho, hindi nila na-follow up. So I guess at the end of the day, this is the one going to overtake hepatitis. Why? Because hepatitis B has a vaccine. And of course, with the WHO putting its strong mandate of eradicating it in 2030, by this time, this metabolic associated fatty liver disease will take over. So yun po ang aming adhikain. I think it's not, we join our hands with the endocrinologists in developing and identifying patients early on with fatty liver disease.
Does the food intake
Yes, of
affect
course.
that as
Opo,
well?
oo, opo. So, kung mataas ang cholesterol nyo, yung metabolic syndrome, mataas ang cholesterol, diabetes is of course
Yes.
food, no?
Right.
So, kung mataas ang cholesterol nyo, especially your bad cholesterol, para huwag nyo
Correct.
matandaan, ma'am, no? Ang bad cholesterol is LDL.
Right.
LDL is keep your LDL low. So, pag ang LDL nyo mataas, medyo huwag na ho kayo kumain ng karne. I think at the end of the day, there is no book that will refute. Sasabihin sa'yo na hindi maganda ang gulay at fruits. At the end of the day, it's fruits and vegetables, Mediterranean diet, nuts, beans that are good for the body.
So, okay, let's get this straight. No alcohol, little or no meat.
Naku, magagalit ng tasa. Maybe you put it in perspective.
Okay.
So, beef, the fat is incorporated.
Right.
Correct. So,
The one
if
that
you're-
has the
yung
fat,
steak.
oo, sarap, di ba?
So, lahat ng masarap, masama sa katawan.
Yes.
Yung
Unfortunately.
yung ang amin po is keep your LDL low. So, ang cutoff ko is 100.
Right. Oh,
So,
I thought it was 200.
hindi. Total cholesterol.
Okay.
So, LDL is 100. And
Okay.
in fact, for men, they are going down to even 70.
Wow.
So, pag mababa po yung LDL nyo, your risk for heart disease, for liver disease is less.
Uh-huh.
So, ang amin ho, like ko sinasabi, show me a book 10, 20 years ago that will refute the statement, fruits and vegetables are good. Talagang yun talaga.
Yeah, I can't show you.
Talagang yun ang talaga. And the Filipinos, because we are rice eaters,
Yeah.
we are prone to the
Right.
glucose that you
Sure.
get in
Sure.
that. And that is why diabetes is increasing. With diabetes comes fatty liver. So yun po ang
Yeah. I also want to know, because we were saying that liver disease comes as a surprise
correct.
many
Yes.
times, where you really never know until it's too late. So
You need to have biomarkers to identify if you have liver disease.
Right.
And this is what we would like to tell everyone. Kung umiinom ka ng alak, di might as well
Meron kang
know
risk, yeah.
when are you gonna stop? Diba?
Yeah.
So yun po. Talaga.
So I want to know, it's like, when you go see a doctor, I mean, you're a little heavy on the side. So do I have fatty liver? Do I not? I drink a glass of wine every so often. I eat steak. When do I go see a doctor? But we got to tackle that at the other side of the break. Because right now, we have to leave you for a little bit for a very short break. Back with you on HEALTHlines, I'm Marilen Lagniton, and I am with Dr. Diana Payawal. We've actually been talking about liver disease. Some very interesting issues have come up. Now, what kinds of symptoms do we need to listen to?
Okay. Well, as I mentioned, it's a huge organ on the right side of your body. Yet it does not complain.
Yes.
So, ang maganda po talaga, pag nagpa-check up po tayo, isama ho natin yung liver, SGOT, SGPT.
Right.
These are the typical blood tests that you get. And of course, ang bago ngayon is we do already one step of ultrasound. No? So pag ang ultrasound nyo may fatty liver, then we go one more step in finding out the cause. So, bakit kayo may fatty liver? Titignan mo na yung, may diabetes ba yan, obese, and then, of course, the other hepatitis B, hepatitis. So, we find out. So, it's like needle in a haystack. We find out where the cause of the liver. After that, then you do certain parameters. You now prognosticate. Ano ba to? Ito ba, magsisirosis ba to? Ito ba, matigas na ba yung atay nito? So, yan po yung bago nating gadget dito sa Cardinal, yung FibroScan. Yun po ay nakakakita kung matigas ang atay mo or masyadong mataba ang atay mo. It's a similar strategy that you get a number. So, kunyari, ang number mo sa fatty liver is 300. That's severe. So, bawal na sa inyo kumain ng matataba. Mag-exercise kayo. Kasi, liver disease is reversible. I will repeat, liver disease is reversible as long as you find the cause. Kung ang sakit nyo ay dahil sa pag-inom, tumigil ka. Hindi ka iinom nung binibigay ng isang yung dating senador na hahawakan mo yung pipata, tapos dito yung gamot. Hindi ho yun. Ang po, talagang tumigil kayo ng kakakain ng matataba, tumigil kayo ng kakainom ng alak.
So, ang sinasabi mo, Doktora, is cold turkey.
Correct. Yes, that's how it is. I mean, especially kung sumuka na yan ng dugo. If you want non-progression of the liver disease, then you might as well stop the etiology. Ano ba yung cause? Kung alcohol, you stop it.
Okay. You were saying kanina, ano ba to? Matigas na ba yung liver?
Yun yung fibrosis.
Oo, but is that curable?
You said it's reversible. There are stages of fibrosis. That's stage 1 to 4.
Okay.
Stage 4 is cirrhosis. Even in cirrhosis, there is compensated, decompensated. So, ang haba ho. Kaya pag nakarinig ho kayo ng ang pasyente may liver cancer, ay ano ho yan, you go back 20 years ago, 30 years ago, ano ba ginawa nito? Nasalinan ka ba ng dugo nung bata ka? May hepatitis B ka pala or may hepatitis C. Ang tagal mo na palang umiinom. Then we compute, no? So, all of this can be reversed at a certain point. Maybe you can actually say, hindi lang siya magpo-progress. For me, that's already stability of the disease. Then you don't need transplant. Ayaw ko talagang as a liver specialist, I don't want to see patients getting transplant. Unang-una, mahal. Pangalawa, sino magbibigay?
Yeah.
Anak mo,
Right.
who are very young. That's like what happened with Senator Cayetano. The son gave. And yet, where did he end?
Yeah.
So what we want is prevention. Yan po ang gusto ko talaga. I feel that if you find the cause early on, that's why I spend time in the clinic because I tell my patients, meron pa nga akong iba. Lilipad pa sa'yo sa iba, sa Cebu, mga ganon. Alcohol. Pagbalik sa kanilang country,
Inom na naman.
Iinom na naman. That really, my heart really bleeds on those patients. Wala akong magawa kasi ang layo nila. So that's why we're developing systems. I have already established liver center. One is in May Pakpak in Marawi. We've done that.
These are support groups or they're actually centers. Okay.
We train doctors.
Right.
When I was here in training for 16 years, I was working with Dr. Tadi and Dr. Palafox. We started internal medicine. I was really gearing up people who I would like to bring in the community. So sila po ngayon ang nagtatag si Dr. Abdel Lukman, Pota pa Liver Center in Amay Pakpak in Marawi. First, for our brothers in Mindanao. Then there's one also now, I set up one in the Kamanaba area, and I set up one in Antipolo area. So yan po talaga, bringing the community awareness is very important.
What is the rate of people who have the disease in this country, comparing for maybe 7-10 years ago and today?
Because we probably they come out earlier. Kasi ngayon, di ba, kung
may
test na ngayon. So, na-identify na sila. So, siguro mas marami. Pero kasi dati
Oo, kasi na-hidden dati.
Hidden sila, so namamatay na lang bigla.
Right.
So ngayon, early on, nakikita na namin alin ang may cirrhosis. Cirrhosis po yung tumitigas po yung atay. No? So, hindi naman yan biglang matigas eh. So, marami.
Pero paano yung doktora? Pag ano na? Pag anong stage na?
The nodule formation, you are now at risk to develop cancer. Sa fertile ground. So, kasi...
But can you stop that?
Bukol-bukol yun eh. Bukol-bukol na atay. Kasi nga, di ba, parang ganito lang yan. Kunyari, may sugat ka. Di ba, nagsisikad, may scab. Yun na yun. That's a wound healing. The stimulus of the liver to address a wound healing event in the liver. Kunyari, ang problema mo umiinom ka ng alak. So, it produces a wound in the liver. So, laging magayong atay mo. So, una, magayan. It's just like nagva-volleyball ka. Kaya mo pa mag-volleyball, pero nagpa-function pa yung kamay mo, pero mapula na. That's the liver. So, anong gagawin mo kung yun lang ginagawa mo? Titigil ka mag-volleyball. So, maganda na yung kamay mo. Inom ka pa rin ng inom ng alak. So, tumitigas, hanggang nagkakaroon ng maliit na yung atay. That's the cause of cirrhosis.
Okay, so Doktora, what are the types of treatment options that you would have if you had any kind of liver disease?
Okay, the cause for hepatitis B, there are drugs. I am going to launch another one. I have launched already 2 or 3 drugs. I'm very fortunate to be the one launching this drug. And there's one in the pipeline that we have launched. We have launched last March, a new drug for hepatitis C. So, yan po maganda. Noon, ang treatment for hepatitis C is 1 to 2 million. Now, it's less than 10,000.
Naku, wag naman kayong uminom, ha? Kahit na mababa na, ha?
Hep C. Yung Hep C po, that is where you get from drugs. Drugs, blood transfusion. Tayo po dati, well, I have to say that the very strong mandate of the government to control drug addiction helped us. They have to come up with strong policies to control drug dependence.
Right.
So, dahil ganon, nag-profit kami. Hindi tayo tumaas masyadong Hep C. Pero ang Hep C, ma'am, dati, 1 to 2 million ang treatment. Ngayon, I'm very happy because it's less than 20,000.
So you're talking about some oral
medications.
Okay,
yes.
okay. What else? You were talking earlier about you don't wish a liver transplant on people.
Well, of course, at the end stage.
Right. Okay.
That's why we have to also be able to address prevention and treatment of end-stage liver disease. No, that's why we have transplant. No. So, ang maganda naman po sa mga pasyente, kunyari yung fatty liver disease, 10% lang. When kunyari, ang baseline mo is 200 pounds, you get 10% of that, which is 20 pounds. So, 180 ka, you reverse fibrosis.
Oh, wow.
Yes, you can reverse fibrosis. So, 20%. So, keep the numbers in, 20%. Keep your SGPT, SGOT normal. Now it has gone, came from a meeting, it's gone down to 19 and 30 for male. 19 for women, 30 for male. So, keep your liver enzymes down. Tapos yung metabolic control. Kontrolin nyo yung diabetes nyo, kontrolin nyo yung cholesterol nyo. These are the drugs. And number one also here in the Philippines and in Asia is drug-induced liver injury from herbal medications.
Oh my.
Yeah, I used to get referrals for those who pampaputi at saka pampapayat. So I think that's something that you need to be very careful. If there is no therapeutic effect and your liver enzymes go high, you have to stop it. Now I'm seeing somebody with 2,000 just from a drug. So you have to monitor. If you are going to get new drugs, you have to put your liver enzymes in, try to see whether you will react to it or not.
Does that include doctor-prescribed drugs?
Number one po yun. Okay, number one. Actually, the one I had now is from cardiac drugs.
You know, talking about, you've talked a little bit about the patients that you had. If somebody comes to you, is confronted with a disclosure from an impending disclosure from you that you have fourth stage liver cancer or something, how do you do that? How do you do that where you don't necessarily scare away a patient? Give us an example of.
Yes, I think that goes with age. Because I've taken care of my mom and my parents.
Wag naman goes with age kasi it doesn't even show with you.
Kasi
okay?
ma'am, when you,
maybe with experience,
with experience,
Okay.
When you with wisdom, no.
Right.
When you become a patient yourself, then you have empathy on these things.
Sure, yeah.
Without actually putting down the magnitude of the problem. I will give an example.
Yes, please.
Kung ang pasyente may cancer, sabihin mo, ay ma'am, wala ho kayong cancer. Ang gagawin niya,
right. This is a situation.
You want to tone down.
Right.
Ang sasabihin mo, ma'am, meron ho kayong bukol, pero hindi pa ho natin alam kung cancer o hindi. Anong gagawin ng pasyente? Iinom yan.
Yes.
Kakain ng marami.
Yes.
But when you say, ma'am, medyo baka ho tayo magkaroon ng cancer. So he will be smart enough to know hindi na siya iinom. Diba? It has to, hindi mo naman mababantayan ang pasyente 24/7. I mean, they have to be educated. Yun ang dapat natin. Kasi as physicians, we have to have disclosures.
Right.
We have to tell patients what they have, especially if they are very intelligent. Kaya lang, ang ginagawa ko iba kasi ang Pilipino, yan ang turo sa amin. Pero ang Pilipino, iba, kakausapin mo muna yung relative. Ma'am, ano ba karakter ni sir? Kaya ba ho niyang tanggapin na may sakit siya? So it takes a lot of coordination. I mean, you have to have family conference, you have to tell them. Kasi pag hindi mo naman sasabihin, baka at the end of the day, sabihin ng pasyente, ba't di ba sinabi, meron ako?
Yeah, right.
So,
and that's a patient's right anyway.
Yes, correct. So we have to be balancing everything. That's why I said it comes with wisdom, it comes with experience. When you see a lot of patients, and when you become a patient yourself, no? So ako, yung mother ko died of breast cancer. So we actually have to be very careful because sometimes it's the depression itself is the one that kills the patient.
Yeah, it's a very emotionally driven exercise. And of course, the emotion rubs off on you and you have to involve, you really are not dealing with just the patient, you're dealing with the entire family as
Correct,
well, right?
yes. Ganyan ho sa Pilipinas. I mean, medicine in the Philippines is totally different when you look at it in other countries. I mean, I've worked there, hindi na kailangan. I mean, dapat sa pasyente lang. So, but that isn't, in the Philippines, we have to talk to first generation, second generation, di ba?
Yeah.
Kasi lalo na kung mag-asawa, pati yung kapatid, di ba by legal, it's only the wife and the husband and the children. But they said, Mom, you have to talk to the sisters kasi these things. And of course, you have to extend a little empathy with them.
Yeah. So, Doctora, again, going back to where you are now, I mean, you do a lot of research, you're very research-oriented as well. And why did you choose gastro for your practice?
Well, I was very fascinated with endoscopy. Ang gastroenterology po, meron ho kaming endoscope.
Right.
It's a camera, no? It's like in Mission Impossible when these things go around.
Mission Impossible.
Diba? Para ho maintindihan ng mga tao, meron siyang camera sa dulo. It's a scope. It has a camera. And we can see inside. So now we are able to prevent cancer. We cut off polyps. We are able to do minimally invasive. So that thing fascinated me. I wanted something to do with my hands. And I think that's where we draw. I always tell my younger residents and colleagues, you have to do something with your hands because you need to do. Now ang bago ho namin ginagawa, itong FibroScan, focus, point of care, ultrasound, we do that. Yan ang mga bago namin ini-embark here in Cardinal Santos.
When I said that this conversation with you actually will have to take several conversations, not just this one, because you have so many interesting things. I mean, I barely touched on some of the things that you spoke of, and there's so much that I need to go back to on many other occasions in the future to have other conversations with you. But I want to thank you for now.
Thank you,
It's
ma'am.
been such a delight, such a true delight to have you on HEALTHlines. And so we hope to see you over and over again. And I know that people out there have learned so much. So thank you, Dr. Diana Payawal. She is a gastroenterologist at Cardinal Santos Medical Center. And I just want to mention again that you are a member of the steering committee of the Asia Pacific Association for the Study of the Liver. And
recently, I'm the first Filipino and woman to be in the Asia Pacific Digestive Federation. So, Digestive Week Federation. Something that I was also surprised to get in, but I think it is an appointed position. And I thank our colleagues in Asia Pacific for nominating.
You were surprised. We are amazed. So thank you again. And I hope to have you over and over again. And that's the honest truth.
Thank you, Marilyn.
Thank
you.
It's
a pleasure to be here, and please take care of your liver.
Thank you. Thank you to Dr. Diana Payawal for those interesting and very valuable insights. Dr. Payawal is a gastroenterologist at Cardinal Santos Medical Center. She is also a member of the steering committee of the Asian Pacific Association for the Study of the Liver. And to all of you who stayed with us during this conversation, thank you for watching. If you have any questions about our topic on this episode, do not hesitate to text or call the numbers on your screen. This has been HEALTHlines on CSNN, your Cardinal Santos News Network. Join us again next time as we continue to break tomorrow's health headlines today.